you. I'm going to have to live up to her expectations, huh? Good morning, everybody. Good morning. It's been a great presentation so far, a great group of people, great information that's been shared. My name is Carmen Irwin. I work for the Centers for Medicare and Medicaid Services in Dallas, Texas. We are the federal agency that actually implements Medicare, and we do have a regional office here in Dallas. I have the luxury or the great opportunity to work in the Program Integrity Department. I work in the Fraud Department for Medicare. In addition to working fraud, I get the joy of coming out and doing outreach. I do both English and Spanish outreach, and my main goal is to not only make our beneficiaries, our Medicare consumers, aware of what your entitlement is, but how do we protect it? How do you get the most out of Medicare? You've paid for it all your lives. You've worked. You're now over the age of 65, or you've come into Medicare through another reason. You need to get the most out of what you paid back to the government, and they're now offering you as coverage. Most people say, well, you know, we hear stories and we see things on the news every day about Medicare and Medicaid fraud, but that's never going to happen to me. Well, I'm here to tell you, it happens to all of us. It is just a matter of knowing what we're entitled to, knowing how to protect it, and also knowing when those benefits or services are valid. How many of you currently walk around with your Medicare card in your wallets or in your purse? Why?
Because we're asked for them all the time by the medical provider.
Exactly, and I understand that. When you have an appointment, you should take your Medicare card with you, but it shouldn't be with you at any other services. If you were to have an emergency or anything of that nature, they can contact 1-800-MEDICARE, give them your name and date of birth, and they can verify that you have Medicare, period. Same with Social Security cards. You should only carry a Social Security card when you're going to need it. And let me just assure you, Medicare is never going to call you and ask you to verify. We are the federal government. We know what you have. We know where you live. We know where to send you the information. So if anyone were ever to call you and say, I'm with Medicare on behalf of Medicare, I'm calling to verify your information, take their name and number and ask them to call back, or you'll call someone to verify. The federal government is not going to call you to verify that information. In addition, how many of you receive your Medicare summary notices every 90 days in the mail? It says, this is not a bill. You know what I'm talking about? Do you read them? Do you verify that everything on that summary is what you received? How many of you got your Medicare New book this year already in the mail? That big, wonderful book. Light reading, right? Yeah. How many of you actually read it or opened it? Okay. The back of the book is the most important part of the book. The back of the book is going to have all the plans and Medicare Part D plans that are available to you as a resident of the state of Texas. And it will list the national plans. For those of you that are jet setters and love to travel all over the world, it will show you what national plans are in there that would cover you if you know that you're going to travel outside the state of Texas or may need that some type of coverage. Most of us say, well, you know, I know Medicare. I have Medicare A and B. Medicare is an alphabet soup. You have Medicare Part A. Does anyone know what Medicare Part A is?
Hospital.
Do you have to pay for Medicare Part A? It's automatic. Ooh, I've got some exciting students in this class. They know Medicare. Medicare Part A is automatic. Some people may have to pay into Medicare to get Part A, but most of you were employed or have it through additional coverage as a dependent from someone. Your Medicare Part A is the hospitalization, skilled nursing, and hospice. Medicare Part B, that's the big one, B for big. Everything in Texas is big, right? Medicare Part B is the part of Medicare that you pay a premium for. That is that monthly premium, and it has an annual deductible. Every year the deductibles change. That's information that you should open the book and look for. You have a Part A deductible and you have a Part B deductible on an annual basis. But your Part B is what you pay a premium for. That is that monthly amount that's taken out either through your Social Security check or you pay it directly to Medicare. In addition, In 2006, Medicare created Part D, which is your drug coverage. That is a choice that every Medicare beneficiary has to choose to have drug coverage. You would look for a Part D plan. For those of you that have retired and have the luxury of having some type of retiree coverage or some additional coverage such as TRICARE, if you're military, you don't need a Part D plan because most of those coverages are included in either that additional retiree benefit or in TRICARE. And also you veterans. If there's some veterans out there that have 100% disability or get VA services, do realize that you really want to check that out because sometimes the VA may not cover certain drugs or the cost of getting the drugs through the VA may be a little bit more costly. You want to always be a savvy shopper. This is your health care. It's like buying a new car or going to the store to pick out something, furniture or anything like that. This is your health care. This is something you want to shop for very, very carefully. You want to shop for it as an individual because it's based on your individual health care. I have a lot of couples that come up to me and they say, well, we have, and I'm just throwing this out here, ARP for both of us. Well, is that the best for each individual in that couple? Or have you looked at what it's going to cover for each of you? Because your medical needs are very different depending on an individual. The reason I bring that up today is because your open enrollment is changing. It starts October 15th through December the 7th. That is when you are given the opportunity to verify your services. Is the plan that I chose last year the best plan for me going into 2012? Is my Part D plan going to continue to cover all my medications? And at what cost? Do realize that these plans on an annual basis can change the tier or level in which they cover those drugs or whether or not they cover those drugs at all. So I go up to a lot of people and I say, you know, open enrollment check. I like what I have. Well, I'm sure you do. It doesn't mean that 2012 you're going to like what they offer. You have to check it. You have to be a savvy shopper. Let's go back to your Medicare summary notices and the choices you have as a Medicare beneficiary. Those of you that rose your hand and said, yes, I look at my Medicare summary notices, thank you. $6.3 billion. Do you guys know what that number signifies? $6.3 billion. That is the amount of Medicare fraud that happened in the year 2010. 6.3 billion with a B. To date, based on the Department of Justice most recent report, between the years of 2008 to 2010, they've recouped $4.3 billion back to the Medicare Trust Fund. But that's a lot of money that went out the door. On a daily basis, Medicare processes 4.4 million claims. Million. And a lot of these people that want to get into the Medicare business and provide you services, I'm very sad to say, are not in it for your benefit nor the federal government. If you ever, about 6 months ago, there was a 60 Minutes report. I don't know if any of you saw it on 60 Minutes, and they interviewed a gentleman out of South Florida. They had his face blocked off, kind of grayed, and he was talking about committing Medicare fraud in the durable medical equipment field. And they were interviewing him, and they said, well, why? Why do you want to get involved in Medicare fraud? And his actual words were, it's easier than running drugs. Less risk, more money, guaranteed by the federal government. It is a big deal nowadays. What can we tell you from a Medicare standpoint? Review your Medicare summary notices. There are mistakes made daily in doctor's offices, in clinics, in the pharmacy. Everything paid by Medicare is based on a code. A human being is the one inputting that code. There are errors that occur every day. And we need to make sure that we're validating and verifying those services that you are receiving. Do realize that Medicare takes the claim on a face value. It is submitted by a provider or supplier. We put it into the system, process the claim, and make payment in 14 days. That's what we call a clean claim. Because we're assuming, the federal government, Medicare, that if this provider or supplier is providing you the service, it's got to be valid. If it weren't valid, you tell us, because in the 90 days when you got your Medicare summary notice, you would be like, I didn't get this. I never saw this doctor. You could call 1-800-MEDICARE, or the simplest way, on that Medicare summary notice, in the top right-hand corner, there is an address. That is the contractor, that is the Medicare contractor that processed that claim for you. If there is something on that Medicare summary notice that is not valid, you circle it and just state, did not receive, or I don't know this provider. You make a copy, don't send the original, and mail it back to that address. That automatically opens up an investigation into that claim. That claim will then be pulled. They would ask for documentation or medical records to support the validity of that claim. What should happen is the claim is checked. If it is valid, you'll get a notice that says no change. If it's not valid and they make an adjustment, you're going to get a remittance notice or another Medicare summary notice 90 days later that says this claim has been adjusted. Okay? So nowadays, every 90 days, you're going to take that Medicare summary notice and you're going to validate it. Another thing that happens, you get those notices from the doctor or clinic, bill is due. We're going to send you to a creditor unless you validate. Pick up the phone and tell them, until I get my Medicare summary notice to verify that Medicare's paid and you've paid, because a lot of them will just give you an ending balance. You have no idea what Medicare's paid. You have a secondary, or you have some other insurance and they can't tell you what's been paid. You really need to verify with those payer sources for that date of service that everything has paid up, and that is truly your copay that you're responsible for. I was happy to hear the police department say that in the city of Farmers Branch that it's illegal to solicit, because I can tell you right now, 90% of the fraud and abuse that occurs is door-to-door solicitation or telephone solicitation. Your doctor should be the one providing you or dealing or telling you that you need Medicare services of either equipment or some type of medical service. It shouldn't be somebody knocking at your door, offering you the latest and greatest piece of equipment for convenience sake. Medicare only pays for medical need. We have a big issue with power wheelchairs or scooters or items of convenience, because if you really don't have the medical need for those, you really don't need to have that billed to Medicare. This is a permanent record. Anything paid for you by the government for Medicare is a permanent record. And we're going to get back to that. Just remember what I said, permanent record, because I'm going to give you some interesting information on a case that happened here in Dallas. In addition, when you receive services from any type of clinical or services in the home, they're going to mention, they're going to look at you or say, oh, you may need this or you may need that. That's information you need to be discussing with your clinician, with your physician, nurse practitioner, whoever you see that's providing you those medical services. People should not be soliciting you door to door, telling you that Medicare is never going to pay for it anymore, you got to get it now. Very aggressive salesmen right now. During your open enrollment, most of you have seen most of the commercials that come out with great actors and actresses from the past, or your mailbox gets full of advertisements. Oh, we have something to offer you. We're great. We work with Medicare. Oh, we offer you these services. You need to be a savvy shopper. You know your medical coverage. You know that you have Medicare, or maybe you've chosen a Medicare Advantage plan, or maybe you have a Part D plan, maybe you've retired and you have retiree subsidy or some type of coverage through your retirement. Do realize that if you make certain changes, or if you sign up for things not knowing, it can actually null and void another coverage. We had a horrible situation. A gentleman had retired, worked all his year for United Auto Workers. He had great coverage. Medicare was primary. United Auto Workers paid all his deductibles, all his co-pays. He did have a premium that he had to pay. He allowed an insurance agent into his home that told him, oh no, I got a better deal for you, I'm going to sell you this plan. He signed on the dotted line, and as of January 1, he lost all his deductible coverage, all his premium coverage, because this insurance salesman had told him that this other insurance was better. He didn't make any phone calls to verify. He didn't even check to make sure that his doctor actually accepted this other insurance. And the doctor did not. These are questions you have to ask. This is your health care. Like I tell everybody, you go buy a car, you kick the tires, you get in it, you play with the horn, you want to see how the windshield wipers work. You got to do the same thing when you're shopping for your health care. I mean, this is important stuff. What are you going to cover? How does this work with Medicare? How does this work with my doctor? Do I get to go to the same pharmacy? Do I get to go to the same clinic? These are the questions you must ask. They're hard questions, but you have to ask these questions. And don't let anybody tell you that you have to make a decision today. That's when I tell them, thank you very much, leave me the information, I'll get back to you. No one should rush you into this. You should be conned into it. You should have the ability to ask questions, ask for the information in black and white. It shouldn't be solicitation over the phone. Send it to me, please. Here's my address. You should know it. You've called me. How do you have my phone number? Easy questions. The ones that call you in the middle of the night, we have a great deal for you. Medicare is offering blah, blah, blah for free. There's nothing free. I hate to tell you. One of the issues I'm going to get back to, we talked about the young lady, permanent records. We had a case here in Dallas 2 years ago. I work in the program integrity department. 84-year-old woman. Her son comes to visit because unfortunately she's taken a horrible fall. She's in the hospital. She's had a hip fracture. She gets discharged from the hospital and only needs 2 items. Because she's in pretty good health, believe it or not, other than the hip fracture. She needs a walker and she needs a seat lift chair. Both of which Medicare will cover. Medicare will cover a walker and will cover for the mechanism that you put into a chair for a seat lift. The key here, though, is to get either one of those items, you have to be ambulatory. You would walk. She goes to the durable medical equipment supplier, hands her the prescription, and says, my doctor's ordered this. He's like, okay, yes, ma'am, let me just do some checking. Medicare could not pay for either. Why? 3 years ago, unbeknownst to her, because she doesn't read her Medicare summary notices, she's very good. She just collects them all in a drawer. And she'll wait till someone comes, like her son or daughter, and she'll hand them to them and see, y'all read this, make sure it's right. Somebody had billed a power wheelchair 3 years ago. She never got it. She never read her Medicare summary notice, and the provider got away with $5,000 because that's how much Medicare paid for the chair. Why doesn't she get the walker or the seat lift chair? Because for a power wheelchair, you can't walk. For a seat lift and a walker, you still ambulate. It's on her permanent record at Medicare that she got a power wheelchair 3 years ago. She had to pay out of pocket for the walker and the seat lift. We did work. We got it cleaned up. A year later, we got the power wheelchair off her record. But these are small things. And there's no cost to you. You've never lost money out of your pocketbook, but someone's stolen from you. They've stolen your entitlement and your eligibility for services from Medicare. It's very crucial you read that information. Medicare does not send it out for their benefit. It's to make sure that what we're paying, what the federal government is paying on your behalf, is valid. Okay? So when you leave here today, you're going to read your Medicare summary notices. Also read your secondary notices, because they're going to be telling. Because most of your secondary or supplemental insurances should be covering that 20% that Medicare is an 80-20 split. So when that 80% is paid, then you have that 20% that either goes to a secondary payer or to some type of supplement, or if you don't have coverage, you're paying that out of pocket. It's a big deal. That's your benefit. Those are your monies. And it's a permanent record. So if something is wrong, we need to know as soon as possible so that we can correct it. In addition, when you go get services from a clinician or from a hospital, I know a lot of people tell me, oh,